Dr. Schuchert, on September 6th, LA County had its first reported vaping death. The week before, an LA County teenager began an anti-vaping campaign from her hospital bed, where her lungs had failed from using e-cigarettes and where had to be put on a ventilator. LA County Public Health Officer Dr. Munto Davis has compared the revelations about e-cigarettes to the slow discovery of the danger of cigarettes several decades ago. Across California, there have been 57 cases of acute lung disease among people with a recent history of vaping since late June, according to state health officials. Parents, kids, and adult vapers are understandably scared by the outbreak of lung disease sweeping the country and claiming lives. The CDC and state health departments, with Illinois at the forefront, have been working together to investigate the outbreak. Dr. Schuchert, as of a couple days ago, CDC has reported 530 confirmed and probable cases of lung disease in 38 states. Are those numbers expected to grow as states examine older cases against the current case definition?
We are seeing more and more cases each day, and I expect the next weekly numbers will be much higher.
Thank you. How does the disease typically present itself in patients' symptoms?
People have days or even weeks of worsening breathing problems, cough, shortness of breath, sometimes with fever or nausea and vomiting.
And what do we know about the time range for symptoms to set in after the last use of e-cigarettes?
We don't have lots of details. It may be days or weeks.
And for those affected by the lung disease, how long are they being hospitalized, and are they typically in intensive care?
The average hospitalization length so far is about 6 days. Many are in intensive care. Many require mechanical ventilation.
That's what I was going to say. How many of the patients require medical intervention to breathe?
A large proportion.
And what has been successful in treating them?
As of now, we know that antibiotics don't have an effect, and that's consistent with the idea it's not an infection, but some are seeing improvement after use of corticosteroids or steroids. We don't have evidence yet about the benefits and risks, but we do think that clinicians should consider use of corticosteroids in treating patients on an individual basis.
So it's potentially some kind of inflammation that is like an acute inflammation.
That's right.
So the joint study by Illinois and Wisconsin found a median age of 19 years old in those two states, and that 32% of those affected are under 18. Why is this affecting young, otherwise healthy kids?
We don't have all the answers, and as we gather more data, we're finding more individuals who are older also at risk. But we do see in our national data, half of the cases are under 25.
And we're deeply alarmed by the 9 deaths, including one reported last night, that are linked to this disease in the short span of its outbreak. Is there anything we've learned about how this lung disease results in death and what we can do to avoid it?
We're really looking into that closely right now. Sadly, we are hearing about more deaths, as you just mentioned, and we do expect more. That's one of the reasons we've been trying to get our health recommendations out there, so that until we know more, people who are concerned about their health risks refrain from using e-cigarettes or vaping products, or at least consider that.
Is it possible that this disease has been going on longer than we thought, and it's just now being linked to e-cigarette use?
I think it's less likely that large scale we've been seeing this and missed it. We're using something called syndromic surveillance now to look back in time at emergency department visits, and we have evidence that things really started to pick up in the spring or summer for this condition. Of course, there probably have been individual instances that we missed.
So when I think about families in my district whose kids are vaping and who are deeply concerned, to me this is one of the most important questions. When specifically should someone go to the doctor, and what information should they convey?
You know, if you've been using e-cigarettes or vaping and you're having difficulty breathing or cough and the kinds of symptoms that we've described, you should talk to your doctor about that. We don't know exactly how rapidly people progress, but we are concerned about the very severe cases we've been seeing in young people.
We've heard from some patients that doctors have not uniformly asked about vaping or juuling. Vapers say no if doctors ask if they smoke. Do you think doctors need to change the questions they ask their patients, and how can we make that happen?
Yes, we recommend that doctors not only ask, do you smoke cigarettes, but ask if you smoke, if you use e-cigarettes or vaping products. We think it's really important at this time for clinicians and parents to educate themselves about the types of products that are out there and to ask the right questions.
Patients who have recovered and released are being told they'll need periodic lung scans. Do we know whether this outbreak will result in long-term or permanent lung damage?
I fear that it may, but we do not know that yet, and we do recommend clinicians do regular follow-up of individuals. The clinical community, the pulmonologists and so forth are studying patients, and of course, it's so new that we don't have long-term follow-up yet.
Thank you so much. I'm out of time, and I yield back.